Good morning, everyone, and welcome to the 6th in our series of modules. And this week the topic is vulnerable populations. We're focusing purely on mental health. That's the context that we're looking at, and it's important that you have an understanding of the Mental Health Act. Remember, throughout the subject, we are looking at legislation that particularly applies to nursing, and the Mental Health Act is one of those that, regardless if you become a specialist in mental health, where you will have a lot to do with mental health patients, but even in general nursing, whether you're a paramedic, emergency care nurse, we'll always have clients who are suffering from a mental illness. So it behoves everyone to have a good understanding of the purpose and the conditions necessarily and that are bound by the Mental Health Act. So for this week, the learning outcomes that you need to meet are to be aware of this legislative framework or the legal framework that surrounds the practice of nursing within the context of mental health. And I will show you particular resources that will assist you with this. So understanding the Mental Health Act in general, it's a very detailed and complex legislative framework, but again, focus on what we're highlighting that you need to know. And things like understanding specific terms. For example, the difference between mental illness and mental disorder and what it means to be a voluntary or an involuntary patient under the Mental Health Act. And we'll look at community treatment orders as well. So essentially, the tutorials will introduce you to the topic of mental health. For many of you, you will have a vast amount of knowledge in terms of if you've got family members or you are an enrolled nurse and you work in the area of mental health, but I suspect that for a vast majority of students, their knowledge might be very sparse in this area. So we start off with an introduction and then we'll introduce you to the legislative guidelines per se. Remembering that in second year you actually do a focused specialist subject, which is NRS 222. So a lot of this will be revisited. So it's generally an introduction, but nonetheless, there's a lot of terms, and remembering you're having a final examination, so this is an area that will be examined. So let's begin by just looking at some of the background in terms of issues in mental health and why it is an area that's particularly fraught with legal and ethical issues. I think that from a historical perspective, people who have a mental illness traditionally and historically have always been very politically powerless and extremely vulnerable, hence the name of the actual module, vulnerable populations. And along with aged care of the elderly, people who have a mental illness, they are the two groups of patients, if you like, where there are significant issues that have been reported in the care and treatment of these vulnerable patients. In other words, that there are a huge amount of notifications that have come before disciplinary hearings and tribunals in relation to nurses who are particularly working in the area of mental health and or aged care. And I think just the few cases that we have looked at to date, you'll recognise this. We've had a few that we've looked at. Now, it's twofold. The area of mental health is particularly complex, and the patients that we are looking after are particularly vulnerable, and the nature of mental illness means that they've got low self-esteem, distorted thinking, which just heightens their vulnerability. And So from a legal perspective, it is doubly important that the care, treatment, and we use that word control because that's under the Mental Health Act, but the care and treatment is exemplary. Because when it's not, it's catastrophic indeed. And I'm going to highlight a very, very recent case that illustrates this. It's also from an ethical perspective fraught with problems because, as you know, the ethical principles, we have autonomy, which is the ethical principle that upholds a person's decision to do what they want with their own body, make their own decisions, their own free will, and beneficence is to do good for the patient. Well, when you realise that someone is very ill, perhaps suffering from or has schizophrenia, their autonomy or their ability to make decisions for themselves is negatively impacted. So that is part of the problem, where you'll have people who are very unwell and are unable to make decisions for themselves. And this comes into where the healthcare providers, you know, in terms of where things have gone wrong, have been very patriarchal, and there has been absolutely no choice for patients and or their carers. And that's one of the missions of the current Mental Health Act. They really do advocate that wherever possible, despite having a mental illness or having a mental disorder, people are able to have their own decisions made, and the best care is implemented where possible. Now, there's a lot of treatment issues per se associated with mental health. For example, the use of psychopharmacology. That's where you've got very powerful psychotropic drugs which, from an ethical perspective, can be problematic. When you've got a young person, for example, who has schizophrenia and the drugs that they're on are making them very overweight, we have problems with compliance and self-esteem. Also, there's lots of issues in relation to legal issues, in relation to informed consent, for example, with ECT, or to use the vernacular for those who haven't heard of that, it's shock treatment. There's seclusion. In the past, there's been psychosurgery. All of those, the stigma associated in the media, for example, the movie One Flew Over the Cuckoo's Nest, if you've ever have a chance to watch that. So there's lots of issues and implications for nursing care, and that's why it's such a vital area that you have an understanding of the Mental Health Act and the purposes of it. So good understanding of the legal boundaries around this area, as well as a very strong moral code, is vital, because in that case, issues like the one that I'm going to show you in a minute won't happen. So I'm just going to take you now to a case that was highlighted very recently in the media. So if I can find it, apologies for that glitch, guys. I'm still working through this screen capture tool. But what you should see in front of you now is a very, very recent case. It was a particularly horrific case, occurred back in just May of this year. Many of you may be aware of it, but it really does bring to the fore that despite education, despite legislation in nursing, particularly within the area of mental health, particular nurses are still cited regularly, and this is a particularly egregious case. And it concerns the case of the patient Miriam Merton, who was a 46-year-old woman, and she was in hospital in the mental health unit at Lismore Base Hospital. And what happened was that Miriam was secluded. She was secluded in for up to 5 hours, and there's footage there that if you wish to you can access, but just a reminder that it's extremely distressing to watch, and it sparked a parliamentary inquiry. But I want to highlight 2 things, and it's the actions of the 2 nurses that were responsible for the care of Miriam. So under the Mental Health Act, that patients with a mental illness, which Miriam had, have the legal right to proper care and treatment. And this was abrogated in this case, because when a patient is in a seclusion room, the policy dictates that they should have regular face-to-face contact. And what the nurses did, they just viewed on a monitor, and obviously they weren't doing it properly, because poor Mrs. Merton was falling to the floor numerous times because she was so heavily sedated with psychotropic drugs. She had no water or toilet and no contact with the nurses on the shift. She sustained dreadful head injuries and then she died. So it's the coroner has slammed this case, in particular the policies in place, and what really comes to the fore, and this is the ethical conduct of the nurses involved, and they have faced disciplinary action. They've both been sacked, as far as I know. There was a senior nurse and a junior nurse. The coroner concluded the incident was not a system failure but a human failure. Now, this was a critical incident, and we look at this in an upcoming lecture. And critical incidents occur usually due to 2 things. Well, 2 areas: when there's a failure in the system and when there's a failure on the half of individuals, like not meeting their standards. This was clearly a case where it was the nurses involved. So we'll see, this will be coming before the tribunal. It will be definitely professional misconduct, and I would argue that they may even face civil jurisdiction as well if the family pursue damages. We don't know, but it's just a dreadful case, and that's what I just wanted to unfortunately highlight for you, that this area, despite all the education, every single year new cases come up. But yes, so I hope that's provided an introduction for you. Begin by looking at your chapter reading and doing some of the activities, and I'll present a few other mini lectures as we go along this topic.